Hello, my name is Jane Doe, and I am the plaintiff who has filed a claim against AU Bright Smiles Dental due to a breach in privacy and confidentiality of my dental records as well as other patients' dental records. Upon review of this dental facility, there has been found instances when patients who have AIDS have had their medical records flagged with red stickers with the word AIDS on the outside cover. The mishandling of the medical records have resulted in other patients and staff without the need to know, to have access, and to view the records, thus resulting in a breach of privacy and confidentiality. In this form, I will discuss AU Dental legal and ethical guidelines that were not followed. I will begin with the first and most common and extensive federal regulation of health and privacy and security, which is known as HIPAA. HIPAA stands for Health Insurance Portability and Accountability Act. The purpose behind this act is to make it easier for people to keep health insurance, protect the confidentiality and security of the healthcare information, and to help the healthcare industry control administrative costs. The focal point of this is the protection of confidentiality and security of the health information. Once again, in this case, there was a breach of security and confidentiality. What is the definition of patient confidentiality? Confidentiality is the right of the individual to have their identifiable medical information kept private. Such information should only be available to the physician of the record and other healthcare and insurance personnel, but only as necessary. As of 2003, patient confidentiality was protected by a federal statute. Patient confidentiality also means that personal and medical information given to a healthcare provider will not be disclosed to others unless the individual has given specific permission for such release. Because the disclosure of personal information could cause personal or professional problems, patients rely on physicians as well as dentists and their people who are practicing under them to keep their medical information private. The Health Insurance Portability and Accountability Act of 1996 requires all professionals and organizations to guard the privacy of their patients and customers. Individuals must provide written consent for any and all release of medical or health-related information. Employees at all levels are required to maintain confidentiality. Similar policies have been in place for some time. This was a requirement of the Joint Commission on Accreditation of Healthcare Organizations, or JCAHO, to maintain accreditation. All confidentiality releases must identify the types of information that can be released, the people or groups who have been permitted to access the information, and the length of time for which the release is valid. HIPAA defines a breach notification in medical information as impermissible use or disclosure of PHI. PHI stands for Protected Health Information. So it's a breach unless there is a low probability that the data has been compromised. To avoid the demise of breach information or notification, the breach notification data must be secured. The term secured meaning the data is unusable, unreadable, or undecipherable to unauthorized persons. In the case with this dental practice, the information wasn't secured, which, if it was, there would have not been any diagnosis information on the outside of the medical record. and the medical records would have been controlled, which would have only allowed authorized personnel to access. Next, I will discuss ethical issues concerning patients' privacy and confidentiality that were not followed. Medical ethics is defined as a systematic or system rules or principles governing right or correct conduct. Each practitioner, including dentists, upon entering a profession, is vested with responsibility to adhere to the standards of ethical practice and conduct set by the profession, including adhering to HIPAA. As mentioned previously, all patients' medical information is covered by HIPAA guidelines, and it is important to understand that HIPAA also has ethical implications. According to the Board of Ethics, professional persons in healthcare delivery fields, including those who work in public schools, have legal and ethical responsibility to safeguard the confidentiality of information regarding the clients in their care. Dentists and all those who practice under their guidance have an ethical and legal responsibility to safeguard patient information. Patient information includes such information as personal data, medical history, diagnosis, treatment, and financial situation, which must all be protected. Patient information should only be shared on a need-to-know basis with those who participate with the care of the patient. Unless disclosure is required or permitted by law, patient information should not be shared with anyone without the patient's written permission. Furthermore, patient information, written or electronic, must be kept secure from loss, theft, or unauthorized access or disclosure. Confidential information should be kept out of plain view and stored in a secured environment. As you can see, HIPAA guidelines were violated when the medical facility flagged the outside of the medical record with the AIDS label and left them in plain view of patients. One way the facility could have avoided this mishap would have been to follow the federal EMR, or Electronic Medical Records mandate, which went into effect in the year 2014. With the medical records being in an electronic form, it would have offered more security and privacy, and it would have offered that security and privacy as long as the rules were followed concerning the electronic medical records. Once again, HIPAA is also comprised of electronic standards which have been violated. The ethical standard was violated when the dental facility did not maintain confidentiality. It is very important that all medical facilities know and follow guidelines that were put in place to protect patients' privacy.